There we
How's it
go.
going?
Good. How you doing?
Good. Thanks for having me on. It's a
Thanks
pleasure.
for coming on. Thanks for taking the time tonight.
Yeah, absolutely. I love your content. It's always so real, and it's an honor.
Thank you. No, thank you. Thank you. The beard's looking good, man.
Thanks, dude. It's growing. It's coming in. It's coming
It's
in
coming in
nice.
healthy. Yeah. Geez, if I try that, I get the patch. It's like space is missing. How was your
How's your
day?
day? Oh, mine was good.
What did you do? What's going
My
on?
day was good. No, it was good. It was an early day. I started around 7:30 today. It was a relatively big case. It was not an all on X case, but it was a bunch of teeth where we had to just take them out and put implants in and do some bone grafting and PRF and it was all of the above. It was a pretty cool case. Patient did great,
That
so it
sounds
was good.
fantastic.
Yeah, yeah, it was awesome.
But it
Good
wasn't an all
collaborative.
on X.
I'm sorry.
But it wasn't an all on X.
It wasn't an all on X. Yeah, it wasn't an all on X. The patient wanted crowns and implants, and that's what
Hmm.
the dentist wanted to do as well. And I think it was a good case. It went really well.
Excellent. Immediate conversion, or that's going to be later date?
Later date.
Okay. Okay. So maybe
Yeah.
like some temporary complete dentures. Did you bury them or you put the posts on?
Well, it wasn't even all his teeth. It was just some teeth that had to come out. Some teeth were good. So yeah, it wasn't. Yeah. Yeah. I typically don't bury implants. I try not to do that. I do everything I can not to bury implants.
Same. Same.
The worst thing is to have to go back and unbury an implant. Oh my God, it's like that's like my yeah, that's the bane of my existence. But
Have you noticed any difference in like the quality of how they heal, whether you put a
no,
cover screw on or a healing abutment?
no, I haven't put a cover screw on in probably a year and a half, and like knock on wood, like I almost always do healing abutments,
Wow. Yeah.
and sometimes like if I'm thinking I'm gonna do like I'm like man like it only torque to like 25. I'll put like a really short healing abutment, not because when you put bigger healing abutments like the longer ones, the ones with bigger height, you worry about occlusal forces and tipping and
Yeah.
yeah, exactly that sort of thing. So, but yeah, I'm a big fan of healing abutments. I try to put them on whenever I can.
Same.
How
I
about
do
you?
that.
Yeah.
Yeah, same. I try and do it all the time. What happens if you get like a torque to maybe 15?
Yeah, that's tricky. I almost don't even, man, I've talked to people that say like as long as if it torques to 15 and there's no movement on that implant, it will heal. The thing is I just don't know if there won't be any movement. So typically if it torques to 15, I won't leave it in. I'm just going to
Yeah.
take it out bone graft and come back to fight another day.
Mm.
If it torques to 20 or 25, then it's a different story. I'll typically leave it, especially if I trust the patient. I'll just put like a short healing abutment on there.
Yeah. Yeah. That's nice. I think one time I even tried to put the suit, like pack the bone grafting in around it, kind of like
Yeah.
prop it up a little
Yeah.
bit,
Yeah. Yeah. Keep it.
prop it up and then get the sutures. Sure, you do the X over the, but then
Yeah.
like kind of put sutures to
Yeah.
hold the bone grafting.
Oh yeah. 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 I mean, do you use PRF as well? Are you a fan?
I'm a big fan of PRF. I haven't been able to use it as much in practice. I think just for some of the demographics. That's I think what it
Okay.
is.
I gotcha. Yeah. I recently, so like when I graduated, I worked in private practice for 4 years, and I never used PRF. I never had the machine, so I just never used it.
Ah,
And then I started reading up on it. I was like, man, like, why don't I do this? This is like low morbidity. If you're going to do an IV sedation anyway, you just take some blood, spin it, and it's easy. You get good results. And I've been doing it a lot recently. So
and how's
yeah,
it when you say recently, like last couple of years or last couple like
I would say in the last year and a half, I did it more than I've ever done it before.
so year and a half. So how do you like the results?
Good, good. Yeah, I think that I get better tissue healing. The tissue healing is quicker. I actually did kind of like a test where I would put them in third molar sites and I'd put them in implants, and I would see patients relatively quickly thereafter and just kind of monitor their progress. And I
Yeah.
like the results. I think that the tissue heals a little bit better. I think some people say it helps you avoid dry socket, and I think that there's probably truth to that. Anish talks about it quite a bit. You and I know Anish. Anish is a great guy. I've known him for years. But Anish talks about PRF a lot, and yeah, I believe in it. I'm a believer. I like it.
I wish because I just chatted with him again last week. I wanted to get you on and then have another convo with him,
Dude, we
but
should
just
do one. We should do one with me, you, and Anish. That guy, he's so humble and he's such a smart guy.
he is. Yeah, I like him a lot.
I've known him since I was in dental school, and he was a resident, and I just learned so much from that guy. Every time I talk to him, I pick something up. He's a great guy.
Let's do it. Let's set that up.
Yeah, he
Is
wants
this
to talk.
time Tuesdays usually good for you?
I mean, I'll make it work. It's every day's random, you know.
Of course. Yeah. Yeah.
Days aren't the same, but typically this time, like six p.m. my time, I think is 9 p.m. your time. Usually will work. So
Okay. Good.
I think we can make that happen.
Let's do it. Let's make it. Let's plan that. Maybe we're halfway through April now, so maybe halfway through May, late
Yeah,
May. Let's set that up. No, I'd really appreciate that. I'd like to hear you guys kind of go like chat, talk, like even to catch up. I would really
yeah,
appreciate
that'd be
hearing that.
fun.
Little catching up
That'd be
on
fun to
stories,
do.
catching up on little things. Yeah.
Yeah, we've got some history. We published papers together. I mean, he was my I consider Anish one of my mentors. He wrote me a reference letter when I was applying for residency. I mean, that
Wow.
guy, he's a gem. He's a great guy.
Where did you go to dental school and where did you go to residency?
Yeah. So dental school, I lived in Milwaukee for 4 years. I went to Marquette and became a Green Bay Packers fan while I was there. Big
Naturally.
head, naturally. And then I went to the University of Tennessee in Knoxville. That's where I did residency.
How'd you like Knoxville?
Dude, I love Knoxville. It still is one of my favorite places to live. And I've lived in a lot of places and I moved around a lot. I think Knoxville, I miss it. Knoxville is one of the only places I miss. It was great.
Wow.
Yeah, really cool. I mean, even better than, so I'm not like a big city guy, like people talk about Nashville all the time. Nashville's fun, but I don't know if I could live in Nashville. It's just too busy for me. I think Knoxville's like the perfect size. Lots of good food, good people. The weather's great. There's so much greenery everywhere, and you have the University of Tennessee, which is a level one trauma center. It was a great residency program too. We did a ton of stuff. It
Huh.
was it was awesome. Dr. Carlson was there. We did a lot of cancer stuff. Yeah, it was fun. Where'd you go?
I was at in NYU in Manhattan.
That's right.
NYU Bell residency. Yeah, yeah. Dental school was Stony Brook, also New York, but out on Long Island, kind of in the sticks. But
Okay, cool, cool. And
it's
you're
so
still
funny.
you live
What
in
was
New
that?
York. You live in New York State still?
Yeah, I'm still on Long Island. I grew up, born here. Yeah,
Awesome. Cool, man.
dude. It's so funny because I keep hearing, especially this last year, keep hearing more and more good things about Tennessee, about Knoxville, especially. I was just
Yeah,
talking to a guy earlier today, an oral surgeon in Knoxville. Chet is his name. I met him at one of the oral boards courses,
I know Chet.
and
Chet went to Chet Metzura.
yeah,
Yeah, he was one of the residents at my program as well. He's a great guy.
yeah, I like
Yeah,
him a lot. He's in
yeah,
Knoxville, so he stayed, and you
yeah.
wish you stayed, or
No, well, interestingly, so I think Chet. Well, actually, I think his wife is maybe Canadian, because I'm Canadian as well. But
oh,
yeah, I think Chet decided to stay in Knoxville. I think. I mean, I don't know if I wish I had stayed, but I think about it. I think about if I would have stayed in Knoxville, how life would have been different. I mean,
yeah.
it's easy to go visit. I still have friends there.
Of course, of course. So wait, so let me get the full picture. I didn't realize you're from Canada. You're in
Yeah.
Canada. You're in Washington now, right?
Yeah. Yes.
And you went to residency in Knoxville, but then
Tennessee.
you were in
Yeah.
dental school in
Milwaukee.
Milwaukee, right?
Yeah.
Marquette's in Milwaukee. Yeah,
Yeah.
it was Milwaukee, Marquette. They always get okay. What? Wow, you've been all over the place
Yeah.
since.
I told you.
Canada.
I mean, I moved around a lot. So I grew up in Edmonton, Alberta, which is West Side Canada. I
Mm.
moved it to I moved to Milwaukee at a relatively young age for dental schools. Lived there for 4 years, and then moved to Tennessee for residency, which was my number one pick. I really wanted to go there, and then moved to the East Coast. Actually, I lived in New Hampshire for 4 years right after residency and did
Wow,
private practice, and then moved to Washington just to be closer to home. Washington's as close as I can get to my family in Edmonton, in Alberta. So
true. What'd you think about New Hampshire then?
I like it. It's like I said, I mean, I'm not a big city boy. I'm more of a farm boy, to be honest. I have
Yeah,
chickens. We can talk about my chickens.
yeah, nice.
Yeah. But no, New Hampshire was fun. I mean, the landscape is similar to what I have here. It's mountains and water. it's a lot colder than the climate that I currently live in, but it was a nice
Yeah.
place. Yeah.
Cool.
No
Yeah.
state tax, no sales tax. I mean, it was awesome.
That's pretty nice. How did they get away with that up there?
I know it's hard to beat that. I think the property tax is relatively high, but
Yeah.
you got to make it up somehow.
It's 1 for 3 though. That's
Yeah,
one
exactly.
for, I was thinking about it. I'm thinking of going around New York and maybe we could push some of our taxes up there to New Hampshire a little bit, save us.
They could use more taxes. No, it was a nice state. It was a good state to live in.
Yeah, New Hampshire's pretty. It's like Vermont, right? They're right next to each other.
Yeah,
It's
exactly.
a pretty
That's right.
area.
Yeah,
What
especially in
about
the
growing
fall.
up? But now you're going all over the place. Like,
Yeah,
so you were in private practice in New Hampshire. You said 4 years,
correct. Yeah,
right out of residency,
right
and
out of
now in
residency.
Washington,
Yeah,
private
private
practice,
practice.
DSO.
Yeah, yeah. So I moved from New Hampshire, made that it was a big trek, cross country
Mm.
trek, and started practice from the ground up. It was a space. It used to be an old gym, and that gym went out of business. So took over that space and developed it into an oral surgery office, which is
Wow,
awesome. Yeah, it's been
from
good
scratch.
from scratch. Yeah.
And you're out. You said you're not a big city guy, so you're not in a city area. How far outside?
No, I'm about 45 minutes to 50 minutes out of Seattle, which is, I mean,
Okay.
close enough that, if you want to go into the city, you can to, go to restaurants, enjoy food, nightlife, whatever. But yeah, where I live, it's a smaller town.
Yeah, that's like the perfect distance. You're within an hour from the city. I mean,
Yeah,
that's great.
exactly. Exactly. Yeah, I agree. It's just quieter. It's more peaceful. Traffic isn't bad. You're not fighting it.
Mm.
I live like 10 minutes from my office. So, I mean, it's a blessing.
It's nice.
Yeah. Do you drive
That's
a lot? I mean, do you have to drive a lot to get to the office?
yeah. I got. I can't complain. It's 30 minutes. That's not too bad.
It's not horrible.
Um,
That's what I
it
used to have.
it's not horrible. It's an hour a day lost.
Yeah.
That's a workout. That's like a meal, whatever. But
Yeah, but
you're so
truthfully, dude,
yeah.
I call it windshield time. Just get on like an audiobook and just listen,
Mm.
learn, do whatever and call people. That's the perfect time to do it. So,
It's a good point. I've been doing that. Yeah, the podcast, audiobook,
yeah.
just music. So many
Yeah.
times it's like we get used to studying. Like for the board exam, I was listening to that Fight Club podcast. I was
Yep.
like running through cases with ChatGPT or
Oh,
Grok
yeah.
or and then yeah, it's like just to listen to a little bit of music now. I'm like, this is kind of nice.
Yeah. Yeah, I know. For months I would listen to on my drive to work and on my drive back when I used to do a 30-minute drive. I
Mm.
would listen to exactly what you're talking about and for studying for boards. And I had like an audio thing for the Nashville review course. And I would listen to that, just different stuff. And it like stop after boards is done is just such a shock to your brain. It's like you don't
Total
even know
shock.
what to do with yourself anymore. You're like, you get home and you're like, what do I do with all this time?
So what is this Netflix? So what?
Yeah, yeah, exactly. Well, speaking of boards, we talked about it a little bit on the phone, but
Mm.
were you able to get hospital privileges? Like, did everything go through? Like, what's going on?
Still
You
waiting
still
on
wait?
it. What are we at now? Like week 6 of trying the second go around for hospital privileges. I actually did reach out to them today. It's taken 2.5 weeks for them to clear my physical exam and my blood work, which, I mean, they filled out the paperwork of the physical exam in front of
Yeah,
me,
yeah.
but they finally cleared it to 2.5 weeks, these corporate systems. But
So much red tape.
yeah, so much red tape. And then that's just to get the board exam to start, right? Like,
God, I'm sorry, man.
talk about
Yeah, it's
exhausting.
frustrating.
Are you close with Sir Wahan? Because he's in the Seattle area, his group.
I'm not. I reached out to him recently, and his internet was down. He was like, there was something going on. Couldn't connect the way we wanted to, but I'd love to connect with him. I know he has an awesome podcast as well.
Good
I
guy. I
follow
like
him.
him a lot. Yeah.
Yeah,
It's funny you mentioned that. It was like 2 or 3 weeks ago. He told me his internet was down. Yeah.
yeah, yeah. I think that's kind of when I was trying to get in touch with him too. But yeah, we'll connect hopefully one day. We can maybe all do something.
Yeah.
And it's
I'll,
cool to
I'll,
collaborate with everybody. Like you
yeah.
get on the social media platforms, and then you just connect. You're all doing the same stuff, and it's just cool to talk about preferences and crazy stuff, insurance.
Yeah. Yeah. We're all doing similar things, but different things. Like I don't do the
Yeah.
videos and me actually doing surgery. Maybe one day, but not yet. And
No,
then now
that's
you got Dr. Anish doing the
yeah,
videos.
yeah, yeah,
We got to get you doing them now.
yeah. I know. I need to hop on that boat.
Yeah,
Um,
you'll get there. You'll get there. But tell
yeah.
me about this practice. So you just started up from scratch? Tell me more about this.
Yeah. So I did my own market research, found a building that, was available in a good area, decent amount of general dentists in the area and good population, growing area. There's a Costco, there's a Home Depot, it's a thriving area. And yeah, I mean, I connected with an architect and a contractor and got it done, man. It was stressful,
Wow.
but it worked out.
So you bought the space. You obviously had to build it.
Yeah.
Did you have to take out
Yeah.
long? I mean, I don't want to pry numbers, but like to give people
No,
an
so
idea.
so I'm leasing it. I
Yeah.
didn't buy the building, but I'm leasing the space. But yeah, it was like a I would say 4 or 5 month process, which is
It's a
relatively
long
quick.
time.
I mean, it is a long time, especially with like different, bumps in the road and things that you have to deal with. But in
Yeah.
retrospect, I mean, it wasn't crazy. I mean, some of these buildings take, 6 months to a year, to get done. So, yeah, it worked out. Thank God.
Thank God. Did you do this while you were in New Hampshire though? Because 4 or 5 months. That's
No, so I was kind of thinking about it while I was there, but I moved and just took some time off, honestly, and just kind of traveled and hung out with family, and in that time period, got everything done. So I took a little bit of time off from work, which was
okay.
nice because I didn't after residency, I just went straight from residency to
Oh,
private practice. So it was literally like the day after residency, like I started working.
oh,
So it was like nonstop. Yeah.
were you
So
psychotic?
yeah, I know, right? A little bit. Yeah. So I needed a little bit of a break, but it worked out.
Are you married? Do you have a significant other? What's
Yeah. Yeah. So I'm married. She's great. She's been super supportive throughout the whole process. And
Where'd you
it's
meet?
been
Like
awesome.
where? Give me an idea of
Yeah. So
where.
she's actually, interestingly, she's from New York.
Oh no way.
Yeah. Yeah. So she's from Staten Island. Well, she doesn't like to tell people, but no, she's great. And she made the move. Interestingly, so she's a city girl. She's a big city girl, loves New York. And I'm not, but she's like adapting to the small town feel, and she loves raising chickens with me now, and it's awesome.
She's
So
45 minutes away from the city though.
it's
She's
not
right
bad,
there.
right? It's not bad.
What's her nationality? Being from Staten Island.
So she is Egyptian. Yep. So she's Egyptian. I'm Egyptian. I'm part Egyptian, part Greek.
Oh,
Born in
awesome.
Canada, so I've got like a little bit of everything. But yeah, I mean, I know New York is very multicultural too. Like you guys have like everybody there.
Yeah, it's a beautiful area. My fiance is Dominican.
Yeah.
It's really
You
cool.
recently, you recently got married, didn't you? Like a year?
Next year we were
Oh, you
engaged.
got
We're getting
engaged.
married
Sorry, yeah, you got
in
engaged.
January.
Cool. Well,
But
congratulations.
also the thing I feel like it doesn't matter what nationality you are, but if you're from Staten Island, it's like they are tough as nails.
Yes.
Right? Yeah. Okay. All right.
Oh
That's
yeah.
right.
Totally. Totally. But so
Protect all
kind.
of us.
So kind. So like they're good people.
Yeah, good people. Good people. All the nurses at Bellevue when I was in residency, they were all from Staten Island, and they were
Yeah.
the best, the funniest, like good people, good New
Yeah.
Yorkers. You know,
Yeah. Yeah. No, that's so what does your fiance do?
she's actually in marketing strategy.
Oh, nice. Does she help with all your stuff?
Uh, not like in not kind of like in a strategic
Yeah.
posting way. That's just me
Yeah.
trial and error everything for
Yeah.
years.
Yeah.
But definitely in other ways. So yeah, a lot of like
Well,
just
good
kind of
bouncing board too, just to like
yeah,
bounce
that's what I mean.
ideas off. Yeah.
Yeah,
That's awesome.
like a thought, like we think through ideas together and see
Yeah.
what we think and
Brainstorm.
stuff.
No, that's
But
great.
yeah, dude. So tell me about these chickens.
Yeah. So we started with people talk about chicken math all the time. So it's a thing. It's like you start with like two chickens and you end up with like a million chickens because you just get more and more and more. So we started with six chickens. Our neighbor is like a farmer. So when we moved in to this area, we met this neighbor. She has goats and chickens and like horses and pigs and like all these different animals. And she's like, I can give you some chickens. I have so many chickens. You guys should just take some of my chickens. And we were thinking about having, a chicken coop and building a chicken coop and having chickens. So we're like, sure, why not? So we took these chickens and we loved them. They started laying eggs and we were getting fresh eggs every day. It was awesome. And then slowly, as time went on, we just got more and more chickens. So now we have 12.
Ah,
And they're laying a lot of eggs and it's fantastic. And I'm like giving them away to all my staff and they're loving it. So
that's
it's yeah, it's great. It's pretty
How much
cool.
maintenance is that? Like, how often do you have to clean
Not a
out
lot, man.
coop?
Not a lot. Like it's honestly pretty manageable. I clean their coop like once a week. You give them fresh water and food every day and just make sure that they're,
Mhm.
thriving. But you clean their coop once a week. It's not bad.
That's not too bad. How long does it take to clean the coop?
That's like 30 minutes. Yeah, nothing crazy.
Okay, not too bad. I asked because actually my fiance and we've actually talked multiple times about getting chickens when she's fully moved in, which this month is the month. Now that we're
Nice.
talking about it, and yeah, we got a backyard, so back there we'd like to have a
Yeah.
chicken coop, like literally that. We have family out here on Long Island that have chickens, so
Oh,
that's why I'm
awesome.
like I'm actually intrigued because this is one of the plans that we had for out here for
Oh,
this year.
very cool.
I'm
So,
serious.
so are there? So there's no restrictions in your neighborhood for having chickens in New York, where you are? I guess where you guys live.
The neighborhood, that's a good question because we have a lot of restrictions in our neighborhood. Like there's no cars allowed on the street at night.
Yeah.
You'll get a ticket. I gotta look into the chicken. We have woods in the back. We could kind of tuck it away. You know what I mean?
Nobody needs.
Nobody needs to know.
Nobody's gonna hear this podcast. No, I'm kidding. No, dude, it's great. I think you guys would love it, and the fresh eggs is phenomenal. I mean, if you like eggs, it's really good. I mean, they're different.
It's the best.
It's the best.
And
Yeah.
then what is it like the Perry and Jerry or whatever eggs? Now we're finding out that they're not as good quality as apparently they were advertising or
Yeah,
whatever.
yeah, and like the Vitality Farms and everything. Like, there's like
Mm,
a huge like lawsuit and stuff, and people are
yeah.
saying they're not actually organic, and it's just like just grow your own, just have your own stuff.
If it's that easy, 30 minutes a week and just every day, sure, food, water, that's
Yeah,
manageable.
yeah, absolutely, totally, man.
Walk in the backyard with your coffee as the sun
Yeah,
rises. It's kind of
that's literally
nice.
what I do.
Really?
Yeah, it's awesome.
That's
Yeah,
great, man.
just wake up in the morning, go check on the chickens, make sure everything's good, and then get to work. It's good. It's a good
Now,
life.
one of the things I hear about the chickens, though, I'm hearing that like sometimes you get one chicken that's just kind of like that's the douchebag chicken. Have you
Oh,
had that experience?
100%. Yeah, I've got a Karen chicken for sure. Yeah,
Ooh.
there's one that like just nips at everybody.
Yeah, that one.
When we had little chicken, or they were chicks, and as they got older, there was that one just really mean one that was always
Mm,
attacking them. We thought about removing that chicken, but I mean, when the smaller ones got older and bigger, it leveled out. So
okay.
it's been good. Yeah,
So now they all nip at.
they're all
Out.
just, yeah, they're thriving together and doing their
All
thing.
right. All
Yeah,
right.
man.
Hey,
Do you have any other pets?
not now. No,
Okay.
just ton of plants around, like
Okay.
palms. Trying to grow coffee plants, and actually, I like the. I mean, yeah, this is a totally different can of worms, but like, I saw somewhere a couple posts like a year ago that the snake plants, the spider plants, and the peace lilies are three of the top five indoor plants for natural air filtering. So
Oh,
I was
nice.
like,
I didn't know that.
and then they're really easy to grow. In fact, the peace lilies are beautiful if you get them to flower.
Nice.
Just put them in like kind of like a dim area where they get a little bit of light but not blasted. And yeah, and so I don't know if I have any fresher air, but it's cute around the house.
That's awesome. Well,
Yeah.
yeah. I mean, they look beautiful. I see them behind you there. I
Oh,
mean,
these are the palms. Yeah.
yeah. These are those are nice, man.
This one was in the background during residency.
Oh yeah.
Yes, it's the same one. It's the same one. This is a newer one. This was a very big one, but it's
Amazing.
yeah. I like natural plants and stuff.
So what are your passions? I mean, obviously you're passionate about plants, but besides oral surgery and plants, like what do you do? I mean, you work out, and like how do you maintain balance? Like I talked to Anish about this, and I talked to other
Mm,
oral surgeons about
mm.
this. It's like time is such a commodity, and it's so limited, and it's
Yes.
so hard to manage everything. What's your take on that? How do you balance life as an oral surgeon who wants to do other things?
Yeah, that's a great question. That's why I find things that are just so out of the blue, like having chickens. You
Yeah.
know what I mean? But with a good purpose, because it's easy to maintain, right? It
Mhm.
fits into your routine. That's another
Yeah,
very important thing that I think people
totally.
overlook. And then three, there's a purpose to it, right? Like you're taking
Yeah.
care of chickens where there's like a heart to it, but then in return you get these fresh eggs. I mean,
Yeah.
is there anything more healthy than that?
Right.
I really appreciate things like that, honestly. And yeah, so like I like the plants in the background and stuff. Yeah, working out is big. Running, I got to get back into like weights. That's I've been pushing that off for 4.5 years now. But yeah, life gets tough. Is exactly what you
It
said.
does. Yeah, it does.
big on podcasting and content. I always
Yeah.
liked music producing and DJing, but that
Oh, no.
takes too much time. So now
Yeah.
like podcasting is kind of my way to connect with people
Yeah.
and learn, like I think it's important for other people to get real time learning and mentorship. Like think about if you were because Dr. Anish wasn't on podcasts until maybe the last couple of years, right? Imagine if you were back in dental school or a pre-dental student listening to him as he
Oh,
was a
yeah.
resident in dental school. I get it. What if he was an early on practice, or a resident or an oral surgeon while you were a pre-dental student? You'd be listening to every minute of every podcast 3 times,
So,
right?
yeah, totally. Have you heard of, I mean, I'm sure you have, Everyday Oral Surgery, that podcast?
Yeah, Stooky.
Ton of good information. I mean, so many dental students, residents listen to that podcast and just learn a ton. And I agree with you. I mean, these nowadays, because of all the different podcasts that are out now, like it's such a learning
Mhm.
opportunity. I always try and take away something, when I listen to anything.
Yeah.
And these podcasts are such a great way to do that. You just catch something. Like even like what's your favorite instrument and why? Like why do you use that thing? I use a
Yep.
different thing, like, and I'd love to actually talk to you about that. Like, what do you use to take out thirds? Like, what's your favorite instrument? Like
Yeah.
even that is a learning opportunity.
Yeah. Well, just really quickly though, you didn't tell me what stuff you do outside of
Yeah.
work and oral
Um,
surgery.
well, besides the chickens, I fly planes, so I'm a pilot.
No
I
way. You're a
Yeah,
pilot?
yeah, yeah, yeah. So I
That's
fly like
awesome.
little planes, like just small Cessna planes and stuff. So
Yeah, just the
private,
dangerous ones.
just the dangerous ones. Yeah, exactly, the fun ones. No, so yeah, that's my passion. I always wanted to be a pilot as a kid, and decided to do healthcare and surgery, and do that on the side, and it's my passion. Yeah, I love it.
The program director from years ago at VCU also was a pilot.
Okay.
So you're the second person, not only in dentistry but in oral surgery, to mention being a pilot, which is like that's so rare too. I only know 3 pilots,
Oh yeah.
four now in my entire life. I know 4 people. One of my buddies from high school,
Okay.
you, the guy from VCU, and then some guy I met who's a commercial. I don't know what he flies, but
Yeah,
dude,
man,
that's
it's so fun.
awesome.
It's so fun, man. It's you got to keep up with it though. You got to maintain it and keep up with
Yeah.
it. Be vigilant and you know study it, which takes time, but it's such a fun hobby.
When was the last time you flew a plane?
I want to say it's probably been like 45 days, maybe 2 months. Yeah.
That's not bad. I thought you were going to be like 4, 5, 6 months ago. 45 days is. Do
Yeah.
you
I
just
mean,
like, do you have your own plane? Like, how does this
no,
work?
no, no. So the easiest way to do it is to join a club, like a flight club, and you just,
Hmm.
not a fight club, but a flight club. But you basically join this club, and it's like a timeshare. You just go pick up a plane whenever it's available, and you pay for the gas, and
Hmm.
you rent it basically for however many hours you want it, and bring it
You're
back.
not like concerned if like this thing has been, had an oil change recently
Yeah, so
or.
it's maintained. So that's
Okay.
the good thing about being a part of a club is the hangar maintains it. Like they have
Hmm.
engineers and mechanics on the site to maintain everything, which is really
Wow.
nice. If you had your own plane, you'd have to do it all yourself and then insure it. It's just a lot. And if you don't fly every day, it's just probably not worth it.
North. Yeah. Yeah. Would you ever fly? Like, how far are you allowed to fly with these things? Can you go
I
a couple
just, I mean,
states over?
you can fly cross country. It just depends on how often you want to stop and get gas.
Wow. So you could fly your wife back to New York.
Oh yeah, yeah. You could. It would be a really long trip, but you could do it
How many times would you have to stop from Washington to New York to get gas?
quite a few times. Yeah. So when I lived in New Hampshire, I would fly a lot. I would fly to like Vermont, which was really easy. I'd fly to
Hmm.
Maine, grab breakfast or coffee or whatever, fly back. Like those were like quick trips.
That's
Like
awesome.
yeah, it's super cool. And you fly. I'd fly into Boston. Boston Airport was wild, super busy. But you'd fly to all these like neighboring states, and that's easy. That's like a quick
Yeah.
hour flight or whatever. Yeah, it was fun. There was one time, man. I don't know why this comes to mind now, but there was one time where I was flying at night. I was flying from an airport, it was an uncontrolled airport, so there's no ATC from New Hampshire. I flew to Portsmouth, and I was flying back, and it was so dark. It was so dark out and the weather was bad. And I thought the Home Depot was the airport, but it was not. Thankfully everything worked out. But because you're on with ATC, you're talking to them, and they're like, hey, do you have the airport in sight? And when you say yes, they kind of just leave. You don't talk to them anymore. There's no communication. So I thought the Home
Oh,
Depot was the airport. So I was like, yep, got it. And then they're like, sounds good. And then I realized that wasn't actually the airport. But
that's
yeah, it worked
scary.
out. Yeah, it was scary. Yeah. There's some scary times, but it's all worked out.
I don't know how you do that, man. I get a lot of anxiety on airplanes, like all the way up,
Yeah.
a
A
little
lot
bit
of
of
people do.
turbulence.
You're not alone. Yeah. Yeah. Especially with
But
the small planes, that could be, I mean, turbulence can be definitely a thing.
yeah, in Coast, have you ever been to Costa Rica?
I've not. No.
You fly into Costa Rica, right? But then you have to take another airplane to get like to a different part of the country. We went to this place called like Crocodile Bay, the something peninsula, and we take this tiny little airplane, like the size of like half a school bus, right? The short school bus, right? And like you can't stand up straight in it. This is probably
Yeah.
a plane
It's
that you
super
fly like
cramped,
every day. Yeah,
tiny.
yeah, one of those. It's got like 6 seats,
Yeah.
and we're in this plane, and it goes right into a rain cloud. And so I'm holding on for dear life as it is. Now in a rain cloud, you can't. The whole plane goes black. You can't see anything. There's like
Yeah.
now we're
At that
hitting,
point, you're using your instruments. Like they can't see anything either. They're just using their instrumentation
and
to fly.
they're just sipping their coffee, like high fiving. They were speaking
And you're
Spanish,
and you're
like
praying at this point. You're like, I just want to survive this flight.
yeah, right. I'm praying. I'm looking like a
Mhm.
psych patient or something, And they're like,
How does your fiance do on planes? Is she cool with it, or is she kind of similar?
she claimed. Great question. She claims that she used to have a lot of anxiety, and
Okay.
that I think she met me, and she's like, oh, I got this in the bag. Look at this guy. That's my thoughts. But man, so you fly plane? No, that's awesome. Terrifying, but that's pretty impressive, man.
Yeah, I mean it's a fun hobby.
So let's go into, you were saying instruments. I want to go into
Yeah.
what your local, because this is good to take from podcasts. I went with Dr.
Mhm.
Anish into like your local routine that you do.
Yeah.
But right before we get into that, I wanted to, how many, like give me a visual of your office. How many chairs you got? How many
Yeah, I
assistants
got
you
you.
work with? Office manager.
Yeah, yeah. So I have 6 ops currently.
Wow.
I don't use all of them yet. So I built it to the size that I want it to get to, if that makes
Mm,
sense. So I have 6 ops. I have a consult room, and then I have office manager, 3 assistants, and front office staff scheduler. So
perfect.
that's
Separate
essentially
billing, or what do you do for billing?
yeah. So my front office staff kind of deals with all of that.
Nice.
Yeah.
Nice. 6 ops, right? How many
Yes.
chairs do you have?
6 chairs.
So you got to fill it out. You got it decked out.
Yeah.
Nice.
Yeah. So 6 chairs. I don't think I have the Criticairs. I ordered 4 Criticairs. I didn't order the last two. I don't think. So they're not fully outfitted. Those last two. I'm using 4 ops of the 6, and then once
Nice.
we ramp up a little bit more, hopefully use all 6.
Yeah. What's your day to day look like? How many days a week are you working? Which days?
Yeah, I work 5 days a week, Monday to Friday. I try and do surgery every day if I can. And I like doing my sedations in the morning. Typical, like most
Same.
people. Sedations in the morning, consults in the afternoon, locals in the afternoon. Yeah.
Yeah. Yeah. And then 9 to 5, 9 to 4. What's your day?
I start typically 8 to 4:30.
Nice day. That's a
Yeah.
great
Yeah.
day right
Yeah.
there.
Yeah. Good
I
day.
bet.
I end a
Yeah.
little bit earlier on Friday, but typically 8 to 4:30.
Yeah. And that's nice. You're only 10 minutes from the office. So an 8 o'clock start's actually kind of the sweet, because
Not
in
bad.
residency, you were starting 7 or earlier,
Oh,
right?
earlier. Yeah.
Yeah. Yeah. So
Yeah.
starting at 8 is like, we got this.
Yeah. Yeah. It's like vacation. Yeah. It's good.
Awesome. I love
Yeah.
it. I'm right now Monday through Friday as well.
Monday to
Yeah.
Friday, okay. And then same hours, or do you start earlier, start later?
Actually 9 to 5. So the 30-minute
Okay,
commute's not bad.
okay.
But the thing for me is I probably take, if I was to do I would prefer to work out in the mornings, get that out of the way, but I don't. I do like content in the mornings,
Yeah,
and that
because
would
you're fresh.
probably take, was that?
Because you're fresh in the morning. You could do the content and all that stuff.
Yeah, like fresh. You can kind of read and like engage and like read comments and kind of filter what do I think about this post, how to edit it. Yeah, yeah, like the thinking stuff, and then I
Good.
exercise after work at the end of the day. Do a quick 10. I do a quick like 10-minute ab workout on
Right.
weekdays, and then do content. But like that's in at 1 to 2 hours. So starting at 9 a.m. is actually it kind of makes the most sense,
Yeah.
you know. Um, but yeah, so 9 to 5, and then right after work is like make quick video, but then go to the gym. Maybe it's
Yeah.
like podcast night, stuff like that. Yeah.
Cool. And then you've got, how many assistants do you have?
It depends. One, they send me to two different offices right now. One office is 4 ops. The other office is 3 ops.
Okay.
But the 4 op one, I'm usually splitting with one other surgeon.
Okay. So 4 ops, but it's 2 surgeons.
Two surgeons, so 2 ops, 2 assistants, and
Okay.
then 2 of the days, Thursdays, Fridays, I get that office free. So I get 3 assistants, 4 ops.
Nice. Okay.
That's a good day. The other one is
Yeah.
3 assistants and 3 ops. But so pretty good. I like the three
Okay.
ops is all I really need, but
Yeah.
no consult rooms. That would have been
Yeah. I don't even, dude, truthfully, I don't use my consult room that often. I mean,
really.
I do consult and surgery in the same room most of the
Hmm.
time. And unless I need like overflow and I'm doing a post-op, I'll put a patient in the consult room. But to be completely honest, you could do everything in the same room,
Yeah,
consult, surgery, recovery, all in the same room.
yeah. And that kind of preps like for a sedation case where it might be a nice setting to have a consult room. I think it does prep the patient a little bit when they're sitting in the operatory but not getting the surgery today,
Yeah.
so that the next time they come in, it's like this.
They're
I was
comfortable.
exactly here. You know what I
Yeah.
mean? Yeah, they're comfortable. They're already prepped. They're
Right.
primed. Whatever the right word would be. So I
Yeah.
kind of like that in a sense too. Yeah,
Yeah. I mean, because it could be anxiety provoking too. Like coming into this
could be.
OR, you're seeing everything for the first time, and you're like, oh man, like, what's going to happen now? But I
Right.
think, like you're saying, just to echo what you're saying, if it's a similar environment, I think it kind of lowers the anxiety a little bit.
Right, because it's like second time, like the first time you're coming in, but you're not getting surgery, so
Correct.
it is anxiety provoking. But you're like, but I'm not getting it today. And then when you
Yeah.
come back, it's like I've already been here. I know where everything. Yeah, like it
Unless
could
it's a same day surgery. Do you guys do a lot of those same day surgeries? Like they come in, consult, surgery, same day?
yes, but I was asked to. I don't do that for sedations.
Okay.
Yeah. I don't know. I like to have a separate sedation appointment, or kids too. Kids too. I
Yeah.
like to have a separate appointment just
Yeah.
because rushing kids that in that same day can cause problems. Sedations and kids. Also with kids, it's like, why are we taking out baby teeth at the oral surgeon's office? Is it because it's actually a surgical extraction? Okay,
Or,
fair.
or behavioral issue, right?
Exactly. And you might not be able to predict that. I like to talk with the parents a little bit, get an idea
Yeah.
there.
Feel it out.
And insurance loves to just say, "Oh, baby tooth, 7140." They're not the pediatric dentist would be taking that out. You
Yeah.
know what I'm
If it was,
saying?
yeah, exactly.
So
Correct.
separate visit, like let's define, are we here because of behavior, you're at
Yeah.
sedation,
Yeah.
or this is a surgical extraction? Then by definition, the insurance cannot be denying this. So I like to,
Yeah.
hold
No,
both.
I hear you. No, that makes sense.
So
Yeah.
let's go through. Let me hear your anesthesia regimen, local. When you're given local
Yeah.
for,
Go
say,
local.
straightforward, clean cut, all four wisdom teeth, full bumps.
Okay. So what am I using and how many? Is
Yeah,
that
yeah, like order, top, bottom, top.
Oh
Left,
man,
right.
yeah. So
Are you lefty or righty?
I'm a righty, so I stand on the right
Okay.
side. I rarely, unless I'm doing a coronectomy or something, I rarely go onto the left side. I know some people will, switch sides routinely and
Yeah.
go to the left side to take out that tooth. I don't. I was just taught that way. So I typically stay on the right as long as I can. If I need to go on left, I will. But for typical set of wisdom teeth, I'll start with, it's local. So you said local. So I like to give the local on the bottom first. So I'll
Hmm.
do like local for just to give it time to kick in. So I'll do 32 and then I'll do 17. And then I'll
Oh.
local just local, like right.
Hmm.
I'll localize those first and then I'll localize 1 and 16 and I'll take out 1 and 16 first because those get, I mean, anesthetized really quick.
Yeah.
So you can take those out quick. By the time I'm done with those, the bottom lip is numb and I'm ready to go and I can take out the bottom ones. So that's my typical
Yeah.
local. If I'm doing sedation, it's different. If I'm doing sedation, I'll localize, I'll give some sedation, I'll localize, and then I'll take out 32, 1, and
Hmm.
then 17, and then 16.
Okay, so you do take out the bottoms before you go to tops.
I do. Yeah.
Yeah, I do that too. Yeah.
Yeah. And
What's your?
I mean, the rationale for that, I remember in residency, one of my attendings was like, if you take out the top ones, and I mean, I don't know how much truth there is to this. I mean, it makes sense and it made sense then, but if you take out the top teeth first, you're gonna have bleeding. And bleeding. There's gonna be blood that trickles down. Stuff kind of might get in the way. So that's what I personally do.
Same. Yeah, I always like to take out the bottoms first before the top, just in case there is that issue of the bleeding down. Like you're trying to see
Yeah,
in a root tip, and
yeah,
the
exactly.
bottom of the socket keeps
It's the
filling up,
most
and it's like,
annoying thing. Yeah,
you know what I mean? It's only going to happen when you least want it to happen.
correct. Do
How
you
many
suture?
cartons was that? What was that?
I was gonna ask if you suture the maxillary wisdom teeth.
Not usually.
Okay.
Sometimes if they're really high and for whatever reason we're taking them out, I might
Yeah.
do a little release at the midway distance in between the molar. I might
Oh
do a
yeah.
little vertical
Yeah.
release and
For
then I'll
like a
repair
vertical.
that.
Yep.
Yeah, I've looked. I haven't had a lot of recession after when I've looked and done that. So I in a week it's right about there, maybe a millimeter short. So
Yeah.
within a month, I think it's going to be fine, and
Yeah.
it gets the tooth out so much quicker
Oh,
without a lot of
100%.
trauma. Yeah, you
Yeah.
know what
No,
I
I'm
mean.
with
So
you. If it's a high tooth, I will do the exact same thing.
right, and high, we're talking like probably like more than 75% up the root of the second molar. Like that's how bit high up the crown is when I'm usually doing that. Like
Yeah.
very high. What's your like?
Yeah. And sorry.
I was just gonna. What's your carpule rotate? Like how many? Like which are you using? Lido, septo, mepivacaine for the or carbocaine for the blocks versus local infiltrations kind of stuff.
I love lidocaine. I mean, lidocaine's my workhorse, so I'll do
Mm-hmm.
lidocaine blocks. If I need to do like a PDL or even the long buckle, I'll sometimes do septicaine.
Mm-hmm.
Lidocaine is my workhorse for sure. Sometimes, truthfully, I don't use Marcaine that much. I'll use Marcaine sometimes at the end of the case if it was like a tough one, and I just want them to have a little bit longer anesthesia. I'll do that. But and if there's an infection or whatever, I'll throw in some carbocaine, make it a nice cocktail. But typically, lidocaine is my workhorse for blocks for sure.
Same. Yep. I like
Yeah,
that. I like lidocaine for the blocks a lot. So lidocaine for the blocks, lidocaine for the local infiltrations in the maxilla too.
yeah. Septicaine, and I'll throw in some septicaine for infiltration sometimes.
Okay. So for your all four wisdom tooth case, any septo for that, or just solely lido, top to
Yeah,
bottom?
yeah. So I'll do probably. I'm trying to think how many carpules. So I would do probably like 6 lidos, maybe 2 septos.
Yeah, that's what I'm at. Like 6 lidos, and then I'll split a septo between 17 and 32 sometimes for
Yeah,
the long
there you
buckle.
go. Yeah, it's very
Yeah.
similar. So you don't use Markine?
We have it. I just have it. It's great. Look, it's great for the long lasting, but I
Yeah,
haven't used it as enough. I just haven't gotten used to it. I don't know.
yeah. I'm with
I
you, man.
could. It's like just one day
Yeah,
we could.
yeah, I know. And sometimes I do. Sometimes I'll throw off my staff, and I'm like, I'll use some marking today, and they're like, what?
What's marking? The
Um,
blue one. Give me the
yeah,
blue one.
the blue one. Man, that's the other thing too. Is like I think carbocaine and septicaine are almost the same color, right? In terms of
Yeah.
it's why, like why
Who's the
not just make one
numbskull that?
green or something?
Who's the
You know,
dumbass that do that? That's
yeah,
dangerous.
yeah, I know. I don't know
Because
why they do.
when do you use carbocaine? Honestly.
When do I use it? I use it for, well, I mean, infections. So I'll use it for infections because the PK is different. But and it works well. But for some people that are like, man, I'm deathly allergic to
Yeah.
whatever, and you're like, okay.
Right.
So you'll use carbocaine, but then you have to fight the bleeding and all that. I almost never use carbocaine alone. It's always in combination with something else.
Right, for the epi with the vascular constriction, but that's
Yeah.
what I was going to say. It's people with cardiac issues or people with like that
Yes.
epinephrine thing. And they're like,
Yeah.
oh no, please, no. And then of course that's the one time you're going to mix it up with the septo.
Right. Yeah, exactly. Yeah, exactly.
Don't
So,
tell them that
yeah,
they had some epi.
yeah, and yeah. So I would hope that the companies do something about changing that, but it's been like that for years.
It's like how decades. It's been
Yeah.
decades, and no
Yeah.
one switched anything. Just make
The
it
other
green. Like what?
Exactly. The other thing is the taste. Like so many people complain about how bitter local
Yeah,
anesthesia is. Like I wonder if they could make it flavored.
like a strawberry or
Yeah, like a strawberry mint or something. I
yeah,
don't
a
know.
little mint,
Yeah.
or find some bitter taste like passion fruit.
Yeah, yeah, yeah. Grapefruit, something.
So let's do instruments. Let's do instruments. You were talking about like what's your favorite instrument to go to.
Yeah.
What question did you have before? What were you thinking of?
Yeah, yeah, yeah. So, like, what is your go-to? Well, first of all, what's your favorite instrument ever? Like, if you had to pick one instrument, that's a tough one. But if you had to pick one instrument in oral surgery, what would it be?
One instrument, I mean, something about the spade, man. That spade, I just feel like I
Yeah,
could get anything out with, you know?
yeah.
Do you have
Like
something like that?
the periotome spade, or like the elevator?
Wait, the periotome spade? I don't know. I don't know which one that is.
Because they make a periotome that has like a spade end to it, which is awesome. I love it. And
Oh,
that's the company Titan makes it. There's a bunch of companies that make them, but they're really nice for taking out roots, like root tips.
yeah. I like the back action spade
Okay, yeah. Oh
elevator.
yeah, 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 I know. Yeah, so I like the 77R, which is like the back action, but it's not the spade. I would say that's probably my workhorse for taking out teeth.
The back action straight, mid, or the narrow.
Probably the mid. I don't know what the narrow is, to be honest, but I it's the 70. It's called the 77R,
Mm-hmm.
and I use that a lot. A lot of people call it the back action. I call it the 77R, but
I love that one too.
yeah, it's awesome. What's your favorite, like, what pickups do you use? What do you like for pickups?
Um, for pickup, just like the regular pickups. I would say that's all I got. That's all
Okay,
I'm giving.
like Adsons, or like
I think they're
I like
the with
Gerald's. I like
the little
Gerald.
hook where they're like
Yeah.
they got the
Okay.
hooks on the end.
Yeah.
Not like they're bent on the end. That's all I meant.
Yeah. Yeah. I like Gerald's.
Adson's got teeth, right? That one.
AdSense. Well, you can get AdSense with. I think you can get AdSense with and without teeth.
All right, all right.
Yeah.
Is that the what would you use? Which one do
I
you
like
use for the
Gerald.
pickup?
So Gerald's are like long and thin at the end, and you can get those with and without teeth as well. That's what I
Oh,
use. Yeah, I use them in residency, and I just love the feel, like in the hand.
yeah,
So I
like
use them.
the bakey. No,
They're not a DeBakey. So DeBakeys are thicker and heavier.
so
Gerald's
thinner than
are
that.
thinner. Yeah,
Okay, okay.
yeah,
What do you use that for on a daily basis?
everything. So anything that I need to pick up, I'll use Gerald's for.
All right.
Yeah, yeah. I almost never use anything else.
Oh, I guess I've been using for like say you just split the tooth and now you flick out the one, but it's stuck on a little bit of gingiva in the back. You go in with the Gerald and use that.
To like, so if it's like if I'm picking up soft tissue or whatever, I'll use the Gerald.
Hmm.
If I need something, if I need to pick out like something from the mouth that's kind of stuck, like I'll use
Yeah.
like a stat, or
Okay.
something a little bit more oomph.
Yeah.
But for delicate things, I'll use the Geralds.
Got it. Okay. So like hemostat, or I use the Ronjour sometimes. Just
Yeah,
pick that.
Rogers. Yeah,
It's stuck to the edge of the crown or something. Just take it, rip it off. Okay.
yeah,
So then everything else. Oh, so you're saying like to hold the tissue while you're suturing or something? Maybe
yeah.
that.
To hold the tissue while you're suturing, or if you're doing like a biopsy or something, you want to
Oh
pick something
yeah.
up. You know,
I like that. I like that a lot. Yeah, the back action, whether it's the back action straight, back action spade, those are the workhorse instruments. I wish we had a better back action. It's kind of, does your back action, you know how the edge of it, the working face of it, is it very curved or kind of
no,
minimally curved with the teeth?
minimally curved with teeth. Yeah, that's the one.
That's the one. That's the good one.
Yeah,
We don't have
yeah,
that. We have
that's
like
the
a
one.
very prominently curved
No,
edge
no,
on it.
I like it flat because you want to be able to really get it in between the teeth, and if it's
Yeah.
too curved, it's hard to do that. Uh,
Exactly. We don't have those. I know the ones you're talking about. Those are the best ones.
yeah, I like those ones. I really like the Cogswell B. I take out a lot of maxillary third molars with the Cogswell B.
Mm. The Cogswell's similar to the crane pick, right? But a little bit different.
It's yes, it's similar to the crane pick, but it's not as sharp. So it's kind of like a
Oh.
dull crane pick, I would say.
Is it wider or thinner or same?
It's kind of like the end of it's kind of like a cone. It's like a cone shape, not
Huh.
very sharp, but it's nice because it's like the perfect angle. I can
Mm.
get it right in there and just give it a little turn, and then the tooth usually comes right out.
Yeah.
Recently, I've been experimenting with pots. Do you
Hmm.
use the pots at all?
I did in residency. Actually, they're really nice for those upper thirds.
Yeah,
Haven't used them in since, since I graduated. They're great though. I know what you mean.
they are.
Yeah,
Yeah, I like them.
those are
Yeah, those
nice
are
for
really
those.
good. Yeah, yeah.
Mm.
I use those typically if it's like a tooth that I can't access very easily.
Yeah.
Uh, I think the pots work really well. They've got like the perfect curve on them.
They do. Yeah, those are not. I would like those. How do you? Where do you order your instruments from? Do you order them? Like what? How do you do that?
So yeah, I mean, all over the place. I'll ask other oral surgeons too, like where's the place where you can get like the cheapest of this thing?
Yeah.
Because
Yeah.
you gotta just look around. Like you can get the same instrument for different prices on different, even on Amazon. I mean, you can get stuff on
Hmm.
Amazon. I get stuff on Dentira. It's called Dentira. Southern Anesthesia. Sometimes I'll order stuff from there.
I've heard Southern anesthesia. Yeah.
Yeah, just a whole bunch of different websites you can find stuff on. I'm trying to think. There's another website that was like our workhorse for a really long time. I can't. It's escaping my mind. But um,
Hmm.
you got to really do your homework because sometimes you'll find on one website, it's one price, and then you go somewhere else and it's significantly cheaper. It's the
Hmm.
same instrument. So yeah, it's weird.
There's because I know obviously Henry Schein, but then there's another one. It's like Germany. I'm forgetting the name of it though. Well, when we remember, we'll put in the chat.
So there's Henry Schein. There's also like the H&H brand, which is
H and
which is
H.
great. Yeah, I get some instrumentation from H&H.
There's another brand that was like Cleveland. It's not Cleveland, but I'm thinking in terms of like golf putters
Yeah.
and irons now. And there's like no, it's not Callaway. It's Cleveland. But there's another one where it's like it's not Henry Schein. It's whatever this
Yes.
other one is. It's
Yeah.
skipping
It'll.
my mind. But there's TBS. I know Bloody Tooth Guy likes to use a lot of TBS stuff. He's
Yeah.
got their
Yeah.
collaboration
He
partnership.
just came out. Yeah. 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 He just came out with like a new Chromic gut, I think.
Yeah, what was different about it? I didn't
I
listen to
don't
the whole
know.
video.
Yeah, I'm not sure either. Yeah, I'm not sure, but I mean, there's a he swears by it. I got to look into
Yeah.
it a little bit more. Maybe he'll send us some free stuff.
Maybe. I don't think he will. I'm not
Yeah.
buying it.
Yeah, no, I would try it. I would try it. I love Chromic. I mean, Chromic, I guess that's another thing to talk about. The suture. I mean, do you use 3.0 or 4.0 Chromic? Chromic's my workhorse.
Great question. I like 3.0 for most things, but for biopsies, I generally like to throw a 4.0 in. What about you?
Uh, Pretty much the same. If I want something to stay closed, like say I'm doing like a tongue biopsy or something,
Yeah.
and it's a big one, I'll do Vicryl. Like I'll throw in some Vicryls in there.
Hmm. 4.0?
But 4.0,
Okay, yeah, yeah, definitely. Same.
yeah.
Yeah.
But 3.0 Chromic is my workhorse. If I'm doing anything gingiva related, like if I'm doing like, I don't know, like anything in the vestibule or anything in tissue that's friable
Yeah.
or whatever, I'll do 4.0.
Yeah. Yeah. I like that. I like that a lot. What about for implants, though? Are you putting Vicryl over those implants?
No, I'm doing Chromic almost every time.
Wow. So you're
Yeah.
doing healing abutments,
Yes.
not cover screws, and you're only using chromic. Okay.
Yeah. Yeah. Is that
Interesting.
different? What do you do?
So I in for the first like 3 months of practice, I was doing Vicryl just like we was sometimes doing residency. But then I
Mm.
was finding when they're coming back for their 2 week suture removal, there's just food and
Yeah.
gunk
Yeah. It's
stuff on the
gross.
Vicryl. It stunk.
Yeah.
And then you take it off and there's a lot of erythema of the gingiva
Yeah.
around. I'm like, this is not
Yeah.
so I'm using monocryl, full 4.0 monocryl now. Nothing
Okay.
sticks to it or anything. Gingiva's nice and
Well,
protected.
the
Yeah.
monocle just glides. The problem with
Yeah.
the Vicryl is it's braided, so it like gets a lot of stuff stuck in it.
Terrible.
It's kind of gross. Yeah.
Disgusting. Oh my god.
Yeah.
Patients come in there complaining like, yeah, my breath stinks. I'm like, I know, I'm sorry. I don't do it anymore. I don't use that stuff anymore.
I had an attending that used to use Proline, and it was like, dude, it was like thorns in the patient's mouth. Like they it would hurt,
Oh,
But he
yeah.
loved Proline. So monocryl. So you use monocryl. Do you only do that if you're doing an immediate implant or for any implant, and why?
If the gingiva is too wide around the abutment or cover screw. Now, cover screws, I'm still packing bone in there and then just doing monocryl over it, maybe with a membrane, maybe a collar plug.
Okay.
But if say a premolar, right? You take the premolar out, then you prep and you put the implant in, and it's very
Hmm.
minimal, like surrounding area around the implant within the socket. Like the osteotomy fits the implant, but if there's little space between the implant and the actual socket, maybe chromic to pack a little bone in there and chromic over the top, or leaving it.
But if it's a
Otherwise, usually,
big space, you're saying you use monocryl.
yeah, yeah, I pack bone in there. Yeah, like a lower molar or upper molar, immediate implant. I'm
Okay.
packing bone around the sides without affecting the implant, of course, just gently packing in there. And then maybe like a membrane over the top. And then I'm
Okay.
suturing monocryl over that in a figure of eight, sometimes in a sec, because the figure of eight, you're doing the corners.
Yeah,
Sometimes I'll put a second one, just an interrupted
I
right
do
over the
that.
middle of it.
Yes, I do that too. So
Good move.
I'll do the figure of eight, and I'll do one interrupted right in the middle, just to kind
Dude,
of
it's a
grow
good
everything.
move.
Yeah, that's a good move. I like that.
I like that one a lot. That one's gotten some good, especially with bone grafting and a membrane
Yeah,
over it. That one's been a really
yeah.
good move. How many times have you come back? You only put one figure of eight in, and then it's gone within a week.
So it depends. Like, I don't know. I really think it depends on the patient.
It
Sometimes,
does. It
like, I'll
does.
get a phone call like 3 days later, and they're like, "Hey, the stitches are starting to fall out."
Yep.
I always tell them like at the consult, like probably around 7 days, like day seven, 5 to 7, sometimes 7 to 10. Like the
Yeah.
stitches will fall. Sometimes they fall out sooner, but you don't know what they're doing, when they get home. So, and I always tell them too, like I personally tell them don't use an electric toothbrush in that area because it vibrates a lot. It'll tear
Right.
the stitches open. I don't like electric toothbrushes anywhere near my implant, to be honest, while it's
Mm.
healing. So yeah, I mean,
It's a good point.
yeah, I tell them to just use a soft bristle manual toothbrush.
That's a really good point. I never thought about that. Yeah, the electric toothbrush is just gonna wiggle the suture
Right.
right out,
Exactly. So I tell them to not do that.
and then the bone grafting too.
Correct. Yeah. What kind of
Mm.
bone graft do you use? Do you like cancellous, corticocancellous? Depends. Whatever your
I like
partners order.
that's whatever the owner orders. That's just the best. Go back in 3 months and it's mush. What the heck? I like cortical cancellous. I like a good 50-50 ratio, maybe a little bit more cortical than cancellous, to be honest. I like that.
Okay.
But in our practice, it's 100% cancellous.
Okay. Gotcha. Yeah. I mean, for me, I think it depends on how much of the like bony walls are still
Yeah.
present, you know? Because if you have the cortical bone still there, like everything, it's like completely atraumatic extraction. I will do cancellous, right? Because you're just putting cancellous bone where it was, surrounding the implant. If you have some cortical bone loss, I will do cortical cancellous just to
What
kind of
ratio?
build that wall up.
50-50 or?
Yeah, usually 50-50.
Okay. Yeah.
Yeah.
Yeah. How do you, that's interesting. Yeah. If the full cortical bone, if the four bony walls and they have the height, that's
Yeah.
a good point. Just pack
Yeah.
some cancellous in there. Also, what size do you have different size? Have you tried different sizes?
I like using this. Are you talking about like volume or like particle size?
Particle size.
Yeah, I like to use the smallest size possible. I
Yeah.
order the smallest thing possible because I really want to just pack it in there. I don't want to see big granules. I hate that.
Yeah.
And when I sometimes when I do and it's inconsistent, like I'll smash it. Like I'll like get in there and
Yeah.
just like really finely grind it down.
Crush it up.
I want it to like really get into the spaces.
Dude,
What do
that's
you use
such a
to?
good
I was gonna ask what you use to
to
pack
pack
bone.
just whatever those it's like it's a whatever instrument, but it's got the two like on the ends
Okay.
where it's like you just plunge it in. Sometimes we'll use like this syringe looking thing to push the bone graft
Oh
in,
yeah.
and then from there I'll
Yeah.
pack it in. Maybe
Yeah.
I'll use a periosteal. But I did want to just touch on. I've never actually talked about this on the podcast before. The bigger sized bone grafting is horrible. We had that in residency because whoever
Yeah.
ordered it was
Yeah.
just ordering the cheapest
Yeah.
thing, and they were literally like 0.5 million. No, it might have been bigger than 0.5 million. They look like wood chips. Like when you're looking at it
Yeah. That's
in the mouth,
crazy. That's
they're like
crazy.
wood chips. These
Because
huge
imagine so
chunks.
the way like to get success from a bone graft, you got to get it where you want it to go. You got to
Yep.
pack it tight and then no movement, right?
Right.
That's how bone heals. So if it's really big pieces, like how are you going to pack that in? You know,
You can't.
like
And it didn't heal.
yeah,
So,
that's crazy.
dude, some people used, actually, someone did this. They tried those they had to do bilateral sinus lift. Someone did the regular, like tiny fine, it's like zero point 0.1 to 0.25
Yeah,
size. And then someone did the point, like literally 0.25 to zero point 0.5. Huge
yeah, yeah.
chips. That side, the sinus was disgusting. It didn't heal. It was like a floating, whatever. It ruined. The other side, perfect. Perfect little mound in
There
the
you go.
sinus.
I
It
mean,
doesn't work, you know?
well, I don't even know why they make it. Like that's I guess for really big defects it would work, Like if you had a really big defect, sure.
Yeah.
But for what
Orthopedic
we're doing,
surgeons. The
yeah,
veterinarians.
yeah, no, but I think yeah, you're right. I agree with you 100%. I think the smaller the particle size, the better. I get the smallest size possible.
Yeah, that's the bet. That's a really good point. Cancellous, 100% cancellous versus 50/50 cancellous
Yeah.
cortical.
Yeah, sometimes
Mm.
for if I'm doing an open sinus lift and I want the bone to really stay in there, I'll use xenograft as well. So I'll mix the xenograft
Mm.
just for volume and just to have it hold space. I don't know. Do you use xenograft often or no?
I haven't used that yet in practice. No,
Okay.
no. I'd like to. I like to try all of them. That's
Yeah.
something hopefully for the years to come to work into.
Yeah.
Yeah. I'm gonna have to ask you some of these questions off air, like where to order some of
Yeah.
these
Yeah.
things.
Yeah. You can text me anytime.
Yeah, yeah, man. Hey, it's getting late over here though, but
Yeah.
dude, we have. I feel like we're just scratching the surface. We got a lot of good. Hey, let's for the next one though. Seriously, let's plan. Let's. I'm gonna make a group chat right now with you and
You
Doctor.
want to do it with English? Yeah. Let's do it.
Man,
I think that'll be
that would
really
be
fun.
phenomenal. Let's go through all these questions that I went over with him,
Yeah.
and let's just run through the whole thing of
Love
the.
to. Yeah. I'd love to.
That'll be awesome, man. Thanks for taking time tonight, Doc.
Man, it was a privilege. Thank you so much.
No, thank you, thank you. We'll talk soon though. I gotta start getting ready for tomorrow.
All right. Sounds good. All right. I'll
All
talk
right,
to you later.
brother. Thanks again.
All
All
right. Bye
right, good
bye.
night.